that constant ringing in your ears, which seems to have no source, and a mental fog that makes concentration and clear thinking difficult. If you are over 50, it is very likely that you have experienced one of these symptoms, or perhaps both, and wondered about the cause. Often, the journey in search of answers leads us to hearing tests, consultations with neurologists, and a series of hypotheses that do not always bring relief. But what if I told you that, for a surprising number of people, the answer is not in the ears or the brain itself, but in a structure we often overlook: the neck. The statement, "Your tinnitus and brain fog stem from your neck," may sound surprising, but it is anchored in a growing body of scientific evidence pointing to a condition known as cervicogenic tinnitus and its associated cognitive effects. This is not an imaginary problem. It is a real issue based on the intricate network of nerves, muscles, and blood vessels that connect our head to the rest of our body. Chronic tension, postural changes that accumulate over decades, and natural degenerative changes in the cervical spine can create a perfect storm of confusing neurological signals. If you have seen various specialists without finding a definitive solution and feel that this description resonates with your experience, keep watching. What we are about to explore today may not only bring clarity about the origin of your discomfort, but also present a simple and safe technique that could be the first step towards regaining the silence and mental sharpness you seek. And if this content already seems useful, consider subscribing to our channel so you don't miss our weekly science-based health tips designed especially for you. To understand how a seemingly simple structure like the neck can generate symptoms as complex as tinnitus and brain fog, we need to look at its impressive anatomical complexity. The cervical spine, composed of 7 vertebrae, is not just a pillar supporting the head. It is a high-tech biological corridor. Within and around these vertebrae pass vital structures. The vertebral arteries, for example, ascend through foramina, openings, in the cervical vertebrae to supply a significant portion of the blood supply to the brain, especially to the cerebellum and brainstem, areas crucial for balance, coordination, and sensory processing. Furthermore, the upper part of the cervical spine, specifically vertebrae C1 and C2, has an intimate relationship with the brainstem and a dense network of nerves. Research, such as that published in neurology and rehabilitation journals like the Journal of Manipulative and Physiological Therapeutics, has explored somatosensory convergence. This is a key concept. Nerves carrying touch, pressure, and position information from the neck, muscles, and joints, somatosensory signals, enter the central nervous system in an area called the dorsal cochlear nucleus. What is fascinating and problematic is that this is the same location where information from our auditory nerve is processed. When there is a dysfunction in the neck, whether due to osteoarthritis, chronic muscle tension, or poor posture, the signals sent by these cervical nerves become abnormal, like static noise on a phone line. The brain, upon receiving these corrupted signals in the same auditory processing center, can misinterpret them as sound, giving rise to tinnitus. This anatomical and functional connection is the basis of what we call cervicogenic tinnitus. The brain's misinterpretation of nerve signals is at the heart of the scientific mechanism behind neck-originating tinnitus and brain fog. Let's delve a little deeper into this process. Think about your neck's proprioception system. Proprioception is the sense that allows us to know where our body is in space without having to look. The small muscles at the base of the skull, the suboccipitals, are incredibly rich in proprioceptive receptors. They constantly send information to the brain about the head's position relative to the body. When these muscles are chronically tense, or when the upper cervical spine joints are misaligned, the information sent is distorted. The brain receives a constant stream of conflicting data. The vestibular system in the inner ear says one thing about balance, the eyes say another, and the neck sends confusing signals. This sensory confusion can overload the brain's processing centers. For tinnitus, as we've seen, this overload in the dorsal cochlear nucleus can cause neurons to become hyperactive, firing without a real sound stimulus. Brain fog, on the other hand, can be explained by 2 main mechanisms that often work together. First, the same sensory confusion causing tinnitus demands enormous cognitive effort from the brain to process, diverting resources that would be used for focus, memory, and clarity of thought. It's like trying to work with a car alarm blaring constantly in the background. Your ability to concentrate drops dramatically. Second, muscle tension and joint dysfunction in the neck can cause subtle but chronic compression of the vertebral arteries, resulting in a slight reduction in blood flow to the posterior areas of the brain. This hypoperfusion, even if mild, can be enough to affect cognitive function, leading to that frustrating feeling of mental slowness and haziness. It is crucial at this point to be transparent and honest about the strength of the evidence connecting the neck to these symptoms. The science in this area is evolving, but the available data is promising and, for many, revelatory. Several observational studies and case reports published in otolaryngology and physiotherapy journals show a very high correlation between the presence of cervical pain, or dysfunction, and somatosensory tinnitus, of which cervicogenic tinnitus is the most common type. In some studies, over 40% of patients with tinnitus also report neck pain or stiffness. Interesting evidence comes from the ability of some patients to modulate their tinnitus, meaning to alter its volume or pitch, through specific head, neck, or jaw movements. If you can make your tinnitus worse or better by turning your head or tensing your neck muscles, that is a strong indicator that there is a cervical component involved. However, this is where we need to be clear. Cervical dysfunction is not the cause of tinnitus for everyone. Tinnitus is a multifactorial symptom, which can be caused by age-related hearing loss, presbycusis, exposure to loud noise, certain medications, temporomandibular joint, TMJ problems, among other conditions. That said, the neck is often a forgotten piece of the puzzle, especially in cases where hearing tests are normal and there is no other obvious cause. The approach we propose here should not be seen as a universal miracle cure, but rather as a powerful and safe intervention for a significant subgroup of people suffering from tinnitus and brain fog, whose treatment has so far been ineffective because the true root of the problem was being ignored. The technique we are about to present focuses precisely on alleviating the underlying cause of this cervical dysfunction. Now that we understand the problem, the scientific connection, and the evidence, we arrive at the practical part. The technique I want to share is a self-applied suboccipital release exercise. The suboccipital muscles are a group of 4 small muscles located at the base of the skull, connecting the first and second cervical vertebrae to the skull. Due to our modern posture, looking down at phones and computers, and general stress, these muscles become incredibly tense and shortened. This tension is a primary cause of nerve compression and the sending of faulty proprioceptive signals we discussed earlier. The technique aims to gently relax this area, decompress the upper cervical joints, and restore a cleaner signal to the brain. It is a method that involves no abrupt movements, cracking, or force. The beauty of this approach lies in its gentleness and how it works with no. The body rather than forcing it. The goal is to create subtle space at the base of the skull, allowing the muscles to relax and blood and nerve flow to improve. Think of it as pressing the reset button for your neck's position sensors. By doing this consistently, we are re-educating the nervous system, reducing the static that contributes to tinnitus, and alleviating the sensory overload that leads to brain fog. Before we demonstrate the full step-by-step, I want to ask for one simple thing. If you are finding this explanation clear and helpful, and feel hopeful about what you are learning, please give this video a like. Your like is an important signal for us, showing that this type of in-depth, science-based content is valuable to our community. Now, let's set the stage to perform the technique as safely and effectively as possible. To perform the suboccipital release safely and effectively, you will need a quiet place where you can lie down comfortably, such as a yoga mat on the floor or a firmer bed. You will also need a simple tool, 2 tennis balls or massage balls of similar density placed inside a sock. This creates a release tool that fits perfectly at the base of your skull. Here's the step-by-step. First, lie on your back with your knees bent and feet flat on the floor. This helps relax your lower back and keep your spine in a neutral position. Take a few deep breaths, allowing your body to begin to relax and surrender to the support of the floor. Now, take your tool, the 2 tennis balls in the sock, and lift your head to position it directly under the base of your skull. The balls should be on either side of your spine, nestled into the soft musculature just below the bony ridge of your skull. Do not place them directly on the spine itself. Find a spot that feels tender but not painful. Once the balls are in the correct position, gently lower your head onto them. The weight of your head will provide all the necessary pressure. Do not force it. The key here is complete relaxation. Close your eyes and breathe slowly and deeply. Focus on allowing the muscles at the back of your neck to melt over the balls. You can remain completely still, or if you feel comfortable, make very subtle, slow movements, such as a gentle yes head nod, or a soft no sway. Do this for a period of 2 to 5 minutes. During this time, it is crucial to pay attention to your body. If you feel any sharp pain, tingling, dizziness, or numbness, stop immediately. The sensation should be one of deep, releasing pressure, not pain. Consistency is far more important than intensity or duration. Practicing this technique once or twice a day can be extremely beneficial. After you start practicing the suboccipital release technique consistently, it's natural to wonder, what should I expect, and when will I see results? It's crucial to align expectations to avoid frustration and maintain motivation. The answer varies from person to person, as each body is unique and the severity of cervical dysfunction also differs. However, there are some general patterns we can observe. Many feel immediate relief in neck and shoulder tension right after the first session. There may be a feeling of lightness in the head or an improvement in neck range of motion. This is the first indication that you are on the right track, as it signifies that the technique is effectively releasing chronic muscle tension. Regarding tinnitus and brain fog, improvement tends to be more gradual. Remember, we are dealing with a recalibration of the nervous system, a process that takes time. Some may notice a decrease in the volume or frequency of their tinnitus within 1 to 2 weeks of daily practice. For others, it might take a month or more. Improvement in mental clarity often follows a similar pattern. You might start noticing that you have more good days than bad days, that your ability to focus lasts a little longer, or that the foggy sensation begins to dissipate at certain times of the day. It's important to understand that this technique is not a standalone solution, but rather a foundational piece of a broader approach. To maximize results, combine it with postural awareness throughout the day, regular breaks for stretching if you work seated, adequate hydration, and stress management techniques. Progress may not be linear. You might have days of improvement followed by a day where symptoms seem to return. Don't get discouraged. This is part of the healing process. Consistency is your greatest ally. As we integrate this technique into our routine, it's vital to view it within a larger context of health and well-being, especially after age 50. The connection between the health of our cervical spine and neurological function is a powerful example of how the body is an interconnected system. Caring for your neck is, in many ways, caring for your brain. This proactive approach to cervical health, focused on muscle release and postural alignment, can have benefits that extend far beyond reducing tinnitus and brain fog, potentially helping to prevent tension headaches and improve balance. However, and this is the most important message I want to leave you with today, this information and technique in no way replaces the evaluation of a qualified healthcare professional. This is our medical and ethical disclaimer. Before starting this or any other exercise routine, especially if you have a history of neck injuries, osteoporosis, rheumatoid arthritis, or any other pre-existing medical condition, it is absolutely essential that you consult your doctor or a physical therapist. They can perform an accurate diagnosis to ensure the cause of your symptoms is indeed cervicogenic and rule out other more serious conditions. They can also tailor exercises to your specific needs and ensure you are performing them correctly. Think of this video as a starting point, a source of information and hope that empowers you to have a more informed conversation with your healthcare provider. Share this video with someone you love who might be suffering in silence. And don't forget to leave your comment below. Did you ever suspect the connection between your neck and tinnitus? Your experience is valuable. Together, we can build a healthier, more informed community, free from the limitations imposed by these debilitating symptoms. Take care, and always remember to seek professional guidance.